As of February 28, therefore, the following border measures will be in place. First, we will be returning to the random testing surveillance program for all vaccinated travelers that was in place before Omicron came in. This means that fully vaccinated travelers arriving to Canada from any country in the world will only need to take a PCR COVID-19 test if they are randomly selected. Further, and perhaps most importantly, fully vaccinated travelers who are selected under the mandatory randomized testing regime will no longer be required to quarantine while awaiting test results. Second, as a parent myself, I know that kids have been impacted severely in many ways in the last 2 years. And that's why I'm glad to announce that we are lifting restrictions for children less than 12 years old of age who are not yet fully vaccinated and traveling with fully vaccinated adults. This means they will no longer need to wait and self-isolate before attending school, daycare, or day camps. They will also no longer be subject to testing and other specific requirements. Unvaccinated travelers, however, will continue to be required to be tested on arrival on day 8 and quarantined for 14 days. Third, travelers will now have the option of using either a negative COVID-19 rapid antigen test or a molecular PCR test to meet pre-entry requirements. To be valid, the COVID-19 antigen test must be authorized by the country in which it was purchased and must be administered by a laboratory, healthcare entity, or telehealth service. Travelers who choose to present a valid negative rapid antigen test will have to take the test no more than 24 hours before their scheduled flight or arrival at the land border. Finally, the Government of Canada will adjust the travel health notice from a level 3 to a level 2. That means that the government will no longer recommend that Canadians avoid all travel for non-essential purposes. I want to underscore that Canadians should still exercise caution when traveling abroad.
This is City News Everywhere.